So I just thought I would go over this ICU treatment sheet and just go over the different areas and what they mean. I apologize beforehand about the shakiness of the video. This sheet is so small that I can't set up my camera and do this without having it in my hand so I can zoom in. So we'll start here. So this is the problem list. In most of the online applications, which this is kind of taken from, these are all things that you can type in and say for SmartFlow or Instinct, which are veterinary software versions of this where everything is done online and everything is done using an iPad or a computer. You can easily type these things in, but this setup is generally taken from those two veterinary software, but it also was taken from before they were available, where we would have something similar. These will be written in, these would be blank spaces to write in, and the doctors or vet techs would fill in the rest of this by using an actual highlighter. So up here we have the example that is in the instructions. So this is a urethral obstruction. The cat had bradycardia and an arrhythmia. So these are the pertinent problem list for the patient at the time in hospital. If this cat had something like hyperthyroidism and was on medication, then that would also be listed here. On this side, we have that this cat is a CPR. Some of them have DNR, CPR, and whether it's closed chest or open chest, and you can circle them because this was done online. You can simply erase or enter in CPR, so there's not different versions on here that could be confusing. Here is the date, the patient, the signalment, so that is the age, the sex status, so male neutered, species and breed, so domestic short hair, and just a general description that this cat is black and white. The weight, and then in the monitoring section here, this is just done from top to bottom. So there's attitude, temperature in Celsius, heart rate in beats per minute, pulse rate in beats per minute, and quality. And these here mean strong, moderate, weak, bounding, absent, or a deficit. So these are the different descriptors you can use describing the pulse quality, because you can see the spaces here are very small. So in my example, I have that there's heart rate is 110 beats per minute, and pulse rate is 110 beats per minute, and this means strong. So because they're both 110, we can assume it's also synchronous. If it wasn't, then we could put something like 90 here and 80 here, and have what the pulse quality is, so strong, but there could also be a D there for deficit. But really, you're always taking the heart rate at the same time that you're taking the pulse rate. So if they are different, then that already indicates that there's a deficit. Then there's the respiratory rate in breaths per minute, respiratory effort. This is eupnic, tachypnic, increased effort, marked effort. You can just put T, E instead of eup and tac, so they fit in here better. Mucous membrane, color, so there's pink. You can put pale pink, which would be PAPI, cyanotic, so SCYN, or some version of that, white, whatever a descriptor would be. CRT is in seconds, which is missing here, but I do have it here. And for all of these, because beats per minute, breaths per minute, and Celsius are indicated on this side, you don't have to have them here. ECG, so blood pressure. So we have systolic, diastolic, and that is represented with the systolic here, a / and then the diastolic. So that's why there is a sys / diastolic in millimeters of mercury, and having the cuff number and the location. And this is important because if this patient is being handed off to another technician, in order to maintain the continuity of care, we need to know what cuff number that was used and what leg. If it happens that the next person doesn't agree with the cuff size or the location, they can change that, but it should be noted because this could vastly increase or decrease the blood pressure, or make it look like something happened where the animal is going downhill or doing better when in fact it's just that the cuff number or location has changed. And then the map is also in millimeters of mercury. ECG, so this is normal sinus rhythm, ventricular premature contraction, or it can be a PVC, premature ventricular contraction. It doesn't matter which one you use, or just arrhythmia. There's so many different descriptors, but for this course, just putting arrhythmia is fine. On here, the Q hour is the frequency in hours of when these are to be performed. So in this example, I have Q 8 hours for all of these monitoring. Of course, if something were to change, it doesn't mean that you only do these every 8 hours. You can see in my example, they're done more frequently because this animal was recovering from sedation. And where were we here? So for ECG, this was at PRN. So because there's an arrhythmia, it is best to be doing this every hour until there's normal sinus rhythm, and then it can be discontinued. And this would be up to the veterinarian in charge to order what the frequency should be. So we have SpO2 in percent, and that's just being done once at 99% in the beginning, but obviously after a sedation, if this number wasn't normal, then we'd want to continue to do that until it is normal. So this is all just really good record keeping and not just following the highlighting because it's there, but using your critical thinking skills and going beyond that. Hydration status, check IV catheter. So CDP is clean, dry, and patent. IV catheter care, bandage change, and the weight. So then for the fluids here, so it's already in mils an hour, and these boxes represent every hour, so 9, 10, 11, 12. So it is already indicated as mils an hour, but the whole chart is in a 24-hour period, so every box here represents 1 hour. So if this animal's on 13 mils an hour, when we started this at 10 a.m., we would put 13 here, and we already know that this is in mils an hour and that every box here represents an hour. Sometimes in practice, we even put a line here, and that would be representing a half an hour. So this would be the first of the hour in half and the second of the hour. So say let's see, this is 1 p.m. We started at 13 mils an hour, and then maybe we went down to 10. Then we can do that there. You don't need to do that for this course, but it's just to give you a better indication of how every box really represents an hour, and you can put that in half. So the biggest mistake that my students make with this fluid section and medication section is realizing that, yes, there are fluids in mils an hour, but these CRIs are actually also in mils an hour, and this does contribute to the overall mils an hour that an animal is taking in. So it's really important to keep them separate. So we have, say, fentanyl, for an example, in mils an hour, and we also have it down here, but it's in mics per kg per hour. So again, these are all represented in hours. And this is important because we need to know what dose the animal's on. And we also need to make sure that we know the total fluids this animal's taking in and what rate that pump or syringe is being set to. So these should be in mils an hour, and these should be in whatever mics per kg per hour the animal is on. So here at 3, the animal started at 4 mics per kg per hour. And that has gone all the way through until at 11, it's turned down to 3. And then at 3 a.m., it's turned down to 2. 6 a.m., it was discontinued. But these are all represented in mics per kg per hour. This is just one dose, so it's just 4 mics per kg IV. So this would be like a bolus or just being given, let's see, at 1400. In real life also, this would have a time associated with it. So again, just for the purposes of this assignment, just putting your initials in the hour it represents is good enough. But in real life, this would have my initials and say 1410 or 1445 or 1450. And that is because if I gave it at 1401 and the animal seems painful, we can go back and look and say, this was given basically right at the 2 p.m. hour, and it's not inappropriate to give another dose, say here at 3 hours later at like 1750. So that's almost 4 hours later. and it's just good record keeping. So going down line here again, another mistake that is common students make is for the purposes of this course again, we don't usually put what the milligrams equal and the mils. One of the biggest pet peeves for bad record keeping is just having the mils of a medication written down and no milligrams. There are so many different concentrations of medications out there, and sometimes they need to be diluted, so it's not appropriate just to have the mils of a medication, say like hydromorphone, that comes in 10 milligrams per mil and 2 milligrams per mil. So just indicating on here that you gave 0.5 mils and not saying the milligrams, even if you have the concentration written down, is still not ideal. So that's what the purpose of this is, just making sure that we have the milligrams here, which is enough. For the purposes of this course, again, we are putting the dosage that's been indicated, so 0.5 mg per kg IV, which equals 2.5 milligrams, which also equals 0.5 mils. So this is too much information, but this is a learning exercise. In real life, it could just be midazolam IV 2.5 milligrams, and it doesn't matter what the mils are to be indicated on here, because this would be something that would be probably indicated in the record that keeps track of the amount of medications and what the cost is. But for medical record keeping, at least having the milligrams of the midazolam is important, not just the mils. Again, this comes in 5 milligrams per mil and also 2 milligrams per mil. So just putting 0.5 mils is not appropriate. So in this section under medications, make sure that your medications have your dosage that has been recommended, and then in brackets, you're putting what that equals in milligrams and in mils. And then on this side, you're just indicating at what hour you are giving those medications. So again, here, Serenia 1 mg per kg IV was given at 9 a.m. or whatever. In your medical record document, you will put the actual time. And then here for the medications that are fluids, we are putting the dosage here, but up here we have fentanyl in mils an hour. And then for the activities, so food given, so the RER should be calculated here, and how often it should be given. So every 4 hours, we're going to be giving this animal 36 kcals or 45 grams of SO. And then this should be highlighted whenever it's supposed to be given. And when that supposed to be given is done, you would then enter 45 grams, how much the animal actually ate. Over here is the water. So every 4 hours, they should be noted whether they still have water, whether they've drank, or whether you've refilled it or refreshed it. So it's still available here, drank, available. If the bowl was a little bit empty, then maybe instead of available, you put fresh. For animals where it's really important to note exactly how much water they're taking in or get a good idea, then you would be putting in here how much water was made available, and then in the next box you would put how much was drank, and you can do that by weighing the bowl with the water in it and then weighing it again after, and the difference in before and after would be your mils. And then vomit, regurgitation, defecation, these are all fairly straightforward for this cat because it has a urinary catheter. We are not taking it out to urinate, so we're not recording anything here. Instead, we're recording the urine volume in milliliters every 4 hours. So this is the urine output, and for an animal that has a urinary catheter in this situation, especially for urethral obstruction, it's really important to monitor closely how much output is being done by this animal. If there's a kink in the line or the cat has reblocked somehow, then this number is really important to be monitoring. They can also get something called post-obstructive diuresis, where they have a large output of urine at one time. But so for the purposes of this, again, we are recording the volume and the output in mils per kg per hour. So this is something that's used in critical care medicine all the time. And this is so that we can indicate, so that's this line here, how many mils per kg per hour this animal's urine output is. If they're being diuresed, which this animal probably was or would be, then this is going to be a high number. Or if that was the post-obstructive diuresis, then this is going to be a higher number. But it gives us an overall picture of what's happening here with the urine volume, and we compare this to the normal output, which is 1.1 or 1 milligram, or 1 mil per hour, 1 mil per kg per hour, sorry, just to give us a reference point. So again, this animal was had a urethral obstruction. It needs to be diuresed to flush out what was ever causing the obstruction. And sometimes with the post-obstructive diuresis, then this number should be higher than 1.1 mils per kg per hour. And if it's not, or it's below, or say like 0.5, that's a huge red flag. And this would indicate to the RVT and the veterinarian that they need to take a look at that urinary catheter and make sure that it's working. They need to look at the IV fluid rate and make sure it's correct. Just give an overall review of what's going on to ensure that the next time this is checked, it is more close to normal or is where we want it to be at. And that's also the reason for monitoring the USG in these patients. So this 0 just represents when the cat was unblocked, and basically the urine should be empty. So in 4 hours later, this would be the first starting point. Sometimes the USG for these animals isn't completely accurate because of the diuresis, but also because they can have plugs and mucus and crystals in red blood cells that is going to artificially increase their USG and make them look like it's more concentrated, when really for a patient like this, having something that's isothenuric or really low, like the 1.009, that's not normal, of course, for any animal, but really for a cat under normal circumstances. But this tells us that we are probably getting rid of all of those components that may have caused that urethral obstruction, and we are really diuresing the patient in supporting its kidneys well. And then under procedures here, so this is where all the procedures that have been done or need to be done in the future are here, and they should have their frequency done. So the PCV is being done every 12 hours. The unblocking would be just done once, so we don't need to put that in there. Blood glucose monitoring. So for this patient, it was being done PRN. We could write PRN there, but this is really just a overall synopsis of what was done and when and what the results were. So make sure for this section, if it's something like blood work, you can put abnormal or normal. So that's what's being done here. In real life, again, we'd probably just put our initials, and that would let the clinician know or the RVT know that at 9 p.m. we can go look up those results and see what they were. For the PCV total protein, this is something that is done often where the PCV in percent is here and / the total protein is here. So that is those ones there. And here we're just monitoring this patient's potassium. And because it's millimoles per liter here already, we can just put in what that is. So 9 is extremely high, and this is actually something that would definitely cause arrhythmias and potentially death. 5 is still really high, but that's a huge increase. So we know what we're doing, which was unblocking the cat, is working. And if you look at this in my example at 9 a.m. when it was 9, if we go up here and look at the ECG, then there is an arrhythmia here. And this is the case I just made up, but it's also being taken from many, many cases I've seen, and it correlates with what's actually happening. Usually for patients that have an arrhythmia like this and a potassium this high, this is an emergency and they need to be unblocked immediately, or a situation where a decompressive cystotomy or cystocentesis may be done. And Just as a side note, when I started doing emergency critical care over 15 years ago, doing a decompressive cysto was considered a huge no-no, but it actually has now become something that could be a beneficial procedure to do, especially if there's going to be any delay in care or a delay in getting this animal the urethral obstruction procedure done. And sometimes this is just a case where the owners can't decide if they can afford this or not, or in regular clinics, they are just trying to decide if whether this should be transferred to a specialty care clinic. So that this is real life. I have seen several cats die in front of me while they have been having the urethral obstruction procedure done, and you can see the tall tented T waves start to get wider and wider until there's asystole. And so that is unfortunate, but it does happen, and it's a good thing to monitor. So anyway, off topic there, but and then down here, UCath care. So usually this will be done every 8 hours. So at minimum, or every 4 hours, sorry. So we would match this up with any time that we're emptying the urine bag and recording the volume of urine, or so here and doing the USG. And the catheter care is also important because some animals can get their heads around their cone, or they get their cones off and they can rip out their catheters, or just flushing a catheter. So I don't have it on here, but that is something that is done quite often, especially if the animal had a lot of sediment and their lines are at risk of plugging up again. For most cats, they have a 3.5 or 5 French urinary catheter, which isn't very wide. So flushing their urinary catheter every 4 hours to ensure it doesn't clog is important. If you do that, then you need to make sure that you record that here so we can add it to the amount of fluids that are going to be in that bag. Because if I flush a urinary catheter with 10 mils of fluid, it's going to make this output number look 10 mils higher than it really is, and that will distort all these numbers. So that's basically it, but this is just, again, going over some of the potential errors in filling this sheet out. So again, fluids, we already know they're every hour. Make sure you're putting the fluid in mils an hour in this section. And that includes this KCl CRI. This is mils an hour, but it also has to go down here in milliequivalents per kilogram per hour IV. And when these Kmax CRIs are done, they are done for 4 hours only. 0.5 milliequivalents per kg per hour is Kmax, or the maximum amount of potassium that an animal can have hourly. So this may come as a shock to some of your CMs, but this is something that I have done regularly for 15 years in every single patient that has a potassium that goes below 3.5 or 3.0 millimoles per liter. So this may seem like something that is ridiculous or something that you'll never do, but now working in a regular practice, I have introduced this and we have used it several times. And then just putting when UDC. And then again, one more time, activities, these are all done, and they can either be whatever you're giving, what they've done, or in some cases it can just be your initials. They're not in this example. And procedures, again, it can just be your initials if you did it abnormal, or putting the actual result here. But so here the catheter was placed, so put placed. Here I did urinary catheter care, so my initials are appropriate. And here, potassium in millimoles per liter, putting the actual result here is really important. We can easily glance at this and see that the patient was well taken care of, and that hour by hour what was done, and it's a quick synopsis or like screen, or I'm not sure what I'm trying to say. It's an easy look at it, so you can quickly see what was done at what hour and how that helped the patient. Another note for these, if in real life we maybe looking at this animal more often. Obviously, we're not going to look at it at 5 p.m. and never do another TPR. I could have highlighted here so that it was just open and highlighted, indicating that the next TPR should be done at 2200. Same with the sedation, eating, all of that. For the purposes of this assignment, I didn't want these to be all clogged up and have you repeat things that really weren't necessary. But they obviously would be fed more than this. They'd probably be on IV fluids longer. So just ignore that and only record and report on here what is asked of you for your case. And even if you know they probably should have more sedation or they should have more TPRs or more drugs or whatever, I purposely didn't have you do them again or repeat them just because putting it on here once is good enough for the purpose of the assignment, and don't read into them too much. If you have any questions, then please email me and let me know, but hopefully this can clear up a bit more of how this is supposed to look. And please use this example when you're going through and doing your own patients. Thanks.